Hey everybody, my name is Dr. Amish Agera. I'm the director for the Center for Clinical Simulation and Safety. I'm also an emergency medicine physician here at Maimonides.
And I'm Dr. Erica Hutchison. I'm a clinical psychologist also here at Maimonides Medical Center, and I've got some expertise in helping folks manage stress, burnout, and trauma that they might experience while working in a hospital.
So we are both part of the Stress Metabolism Initiative here at Maimonides. The goal of the Stress Metabolism Initiative, or SMI for short, is to support providers through difficult circumstances and situations and provide meaningful education for all staff here at Maimonides. An example of that would be psychological first aid, which is what we're going to primarily be talking about for the next 20 minutes or so.
I guess let's start with what psychological first aid is, right?
Yeah.
We know that working in a hospital is really stressful, right? And so all of the things that we're trying to do are to help everybody who works in the hospital to manage that stress, however it might look. Today, we're going to talk a lot about psychological first aid, which is basically like physical first aid. So it's the kind of thing that has a very specific set of instructions, and it is really just the very basics that anybody who has some really super basic training is going to be able to do. And so basically, it aims to do a couple of different things. One, it helps to aid people in processing stress in real time. So if you're stressed out right now, it's going to help you to calm down in the moment immediately. It also is really sort of resilience-based and empowering. So it's going to help a person to connect with their own supports and their own coping strategies that they already have. So we're not necessarily teaching anything new in the moment. And it's also sort of like forward moving. And so it's going to help people to continue to connect with those things as they move forward.
So Eric, everything you said makes perfect sense about psychological first aid, but if I was going to be totally honest, sometimes it feels a little taboo to talk about stress in the hospital setting. To be honest, both myself and I think a lot of other providers who work in the hospital were taught that stress is part of the job and we just have to deal with it and move on.
I've heard a lot of people in a lot of different departments say things like that. But I think it's really important to acknowledge that any kind of job in the hospital is a stressful job, whatever role you might be in, because you deal with so much. But sometimes we're going to face things that are too big to compartmentalize or box up in the moment, and we just can't move forward right away like we normally would. So having a range of tools for managing our stress is going to be good for us, but it's also ultimately going to help us to provide better care to our patients and really to work better as a team.
So can anyone provide PFA?
Yeah, absolutely. And actually, this is part of why I get so excited about PFA, because really anybody, as long as they have some basic skills and knowledge, can do it.
How would you know what the right time to provide PFA is?
Oh, that's a really good question. To start off, I'm suggesting that you only really offer PFA to somebody that you've already got some kind of working relationship, somebody who, you already know their name, you already know what their role is in the hospital. Given that, there might be a few ways that you know when is the right time for PFA. So one, you might notice that a person was involved in a really difficult or stressful clinical situation, or really any kind of situation in the hospital. So noticing that gives you an opening to say like, hey, I saw you were involved in X. How are you, right? Another way that you might know that it's time to think about offering PFA is if you see that a person that you know is acting or behaving in a way that's a little bit different than usual. So maybe they are seeming a little bit more stressed. Maybe they are acting a little bit shorter with the people that they're working with. Maybe they are like really working through the whole day. They're maybe overworking themselves in some ways. And also you might notice some emotional stuff too. So maybe somebody is really talking a lot about feeling guilty or feeling badly about something that happened. That's a really good red flag that, maybe they need a little bit of extra support or a little bit of validation.
How would I start this conversation off? I'm still a little worried about, coming off as a little intrusive.
Fortunately, it's really not that hard to do.
Okay.
So you could just say like, hey, I saw you were involved in that really difficult case. How was that? How are you doing? You might also say like, hey, let's go for a coffee. Let's take a break together and use that as a segue to ask sort of how they're doing. You might just ask, how's their day been? right? So all of those, I think, are pretty natural ways to start a conversation that you probably already do all the time anyway.
Yeah, that's
right?
exactly what I was going to say. It
Yeah.
kind of just sounds like two people talking, as
Yeah.
opposed to sort of this fear I have of,
Mhm.
potentially trying to, psychoanalyze somebody, which is
Yeah.
not
We're
what
not
this
doing
sounds
that.
like.
No
Yeah.
psychoanalyzing.
Okay. So how about if we watch a couple videos where we see two healthcare colleagues interacting with each other? Perhaps you can offer some things that went well and maybe some opportunities for improvement.
Hey, Lisa.
Hey.
Hey, I saw you were really involved in that a case back there. What happened? Parents seem super freaked out.
Yeah, it was a pediatric traumatic arrest. Parents are devastated. I actually thought the kid was going to make it. Not totally sure what went wrong.
Oh, wow. That's wild. I mean, I had a case just like it on my last shift, though. Seems like everyone around here is just having a crappy week.
Yeah, it's definitely been a rough week for me. Starting to feel a little bit overwhelmed.
Yeah, but I mean, things could always be worse, right? I mean, we've seen worse.
Yeah, I guess it's healthcare.
Yeah, and I mean, in healthcare, you have to have, like, thick skin, right? You have to get through it.
Yeah, I guess I'm going to go see my next patient.
No, but I mean, hey, let's blow some steam off. You want to go get some drinks after work?
Let me see if I can wrap up here and maybe I'll see.
Yeah, no, let's do it, girl. It'll be fun.
Okay.
So let's start with the positive.
Okay.
What went well with this interaction?
Something that did go well was that the colleague noticed that this person was having a tough time or seemed kind of down and took the initiative to really stop and check in. So I think that that's a positive start, but it didn't really seem to me like the colleague was feeling supported or that she seemed to be feeling better after the interaction.
So what could she have done differently?
Yeah, so I think focusing on the one specific skill of PFA that we're really trying to hone in on here, really one of the most important ones, is to think about the language and the way that a person speaks with a colleague. And so we're going to talk a lot about reflective listening. There's really three basic steps for reflective listening. First, restating and paraphrasing. So just basically acknowledging that you've heard what the person said and kind of like, giving it back to them. The second step is recognizing and naming emotions. So pulling out feelings words that a person has already used, highlighting those, or if a person hasn't used any feelings words, to say like, oh, it seems a little bit upsetting, or it seems like that was kind of frustrating, trying to take your best guess at that to acknowledge the emotion of what's going on. And then the third part is showing understanding and non-judgment. So whatever that person has to say, you're going to respond in a way that sort of says like, hey, it's okay that you're feeling whatever kind of way, or that you're having whatever sort of experience. And so that wasn't really there. She was making a really good effort, but she didn't quite get those steps.
Is there anything that we could learn from that last video? Maybe some pitfalls that we should try to avoid when providing PFA?
Yeah, some of the things that I'm going to mention are usually well-intentioned, but they don't have the intended effect when they're actually used in practice. So, for example, here are a few things that we really want to try to avoid, some common pitfalls or don'ts.
Okay.
So first, we really want to make sure that we're not sharing too much about our own experience or turning the spotlight back on ourselves. It's okay to say like, hey, I understand what that might feel like, or I've definitely been through the same thing.
It's about them, not you.
But you want to definitely be doing more listening and have more focus on what the other person is saying.
Got it.
It's also really important to avoid using that kind of like silver lining language. And so what I mean by that are things like, oh, it's going to be better tomorrow, or, it could be worse, which is something that we heard in the video. It could always be worse, which sounds like it's meant to be helpful, but actually ends up being pretty invalidating and communicates accidentally usually that, how you're feeling is not important.
Yeah, I think we all do that a lot, actually.
Yeah. Another thing is to try to avoid filling in the pauses. So a lot of times in a particularly emotion-focused conversation, because people are not so comfortable with that,
Sure.
they they don't let there be any, there's no silence.
Mhm.
And so there's a pull to sort of like fill that in immediately. But actually, sometimes it's really important to let that person sort of sit for a second and let them, take a moment to think about how they're feeling or to take in what it is that you're saying. So it's okay to just let there be a little bit of silence. And actually, 5 seconds of silence, even though it can feel like a lot from our end, it doesn't feel like anything on the other side, right?
Okay.
Another important thing to avoid is going into like detective mode, even though a lot of the people who are going to be offering PFA are clinicians. Not everybody, but a lot of people are clinicians, and we're really trained to get to the bottom of what's going on, right? To ask all the questions, to figure out what's happening, what happened before, what's happening right now. And that's really not what PFA is about. PFA is just about being with that person in whatever they feel like sharing. So you don't need to ask more about clinical details about the case or what specifically happened with the family. And so in this video, we saw her come up and kind of say, wow, that was so crazy. What happened? Almost in a, this is sort of exciting. Let me get the juice. So we want to avoid that too, right?
Yeah, I guess that makes sense.
And then the other important thing is making sure that the body language is matching the situation. So we saw a lot of this colleague sort of, first she was standing, right? So she's not in eye contact, not helping the person to feel a little bit calmer or connected with. And she was also on her cell phone a lot of the time, right? So she's not making good eye contact. And I think it was pretty clear by how her colleague was responding. She kept kind of turning around. She wasn't feeling connected, I don't think.
Right.
So those are a few things to keep in mind, and let's see how the second video goes.
Yeah, let's do it.
Hey, Lisa.
Hey.
Hey, I saw you were involved in a really tough case earlier. I just wanted to check in and see how you're doing.
Yeah, I'm actually pretty bummed. It was a pediatric traumatic arrest. Parents are devastated. The kid just got into college. It's been a pretty terrible week for me.
Wow, I hear you. Sounds like a tough week, and then on top of that, just having to take care of a patient who didn't make it. That sounds pretty overwhelming.
Yeah, I don't even have time to feel overwhelmed. It's just the territory of working in a big, busy city hospital, though.
Yeah.
I just wish I could have bought him back.
Makes sense, though, that you're feeling overwhelmed and maybe even a little sad.
Yeah, I guess. I just need to get over it and see the next patient, honestly.
No, but I know you have more work to do, but just anyone in that room would have been feeling really overwhelmed right now, and it's a normal reaction. So if you have to take some time, I can see the next couple patients.
That's true. It's helpful to hear you say that. I didn't really realize how much this week really affected me. Maybe I do need to take a minute or two before I see the next patient. I don't even know how to do that anymore.
Yeah, what helps you refocus when you're having a tough day?
Honestly, right now, even just going outside, taking my mask off for a few minutes and taking some deep breaths.
Yeah, I think that's a great idea. And if you're still feeling this way later, I'm sure there's something you can do at home that helps you de-stress.
Yeah, maybe I'll try to go for a run if the weather's nice.
Yeah, that's a good idea. And is there anyone that you can lean on, either here at work or back from home?
I do have a girlfriend who I usually call about difficult cases. I just don't want to burden her.
Well, just think if the situation were reversed. Would you feel bad if she reached out to you after a tough day at work?
No, I think actually I would feel honored if she called me. Yeah, maybe I'll give her a ring.
I think you should.
Yeah, I'm gonna take a few minutes and just step outside. I have my phone on me if anything happens. I'll be right there.
Totally.
Thanks.
Okay, so what's your reaction with this video? Seemed like it went a bit better.
I think it did go a bit better.
Okay.
So she did a really good job of hitting all 3 points of the reflective listening. So first, she was able to really listen and hear what was being said so that she could accurately repeat it back or paraphrase it, right? So she said, I hear you. It's been a tough week overall, and on top of that, you just took care of this patient that didn't make it. So she did a really good job of hitting that. She also did a great job of focusing on the emotional content. So she said, it would make sense that you're feeling pretty overwhelmed. And then she kind of added, and maybe even a little bit sad too, right? So she's hearing it, she's picking out the words, but she's also really kind of feeling being empathic with the person
Okay.
in the moment.
Okay.
And then finally, she was definitely conveying that she was understanding what was going on, and she was very non-judgmental too.
So I noticed towards the end of the video, it was suggested that some of the existing support she might have be utilized. What was your take on that?
Yeah, I noticed that too. And that actually is a further step of PFA. So reflective listening is one particular step, and then helping a person to connect with their already existing coping strategies and supports is sort of the next step. So when you're thinking about how to help somebody to connect with their coping and supports, there's really three main points that you want to hit, three main questions. So one, what can you do right now in the moment to help yourself to feel better? The second question is, okay, after you go home, what can you do to help yourself to feel better then? Or what can you do as you go through the rest of your shift to help you feel a little bit better? And then the third question is about the supports. So who can you talk to as you go about the rest of your day, either here on shift or when you get home?
What if I start trying to provide PFA and at some point I realize I'm also stressed out? What do I do then?
Yeah, so this is a really important question. It's important always to first check in with ourselves before we start to offer PFA. So if you're really stressed out or even, moderately stressed out and you try to offer PFA, it's going to be harder.
Okay.
So that's always got to be the first step. We got to check in with ourselves first. So another reason that a person might feel in over their head is if in the moment when you're offering PFA, you realize that the person you're speaking with actually needs more help than you're prepared to offer from a PFA perspective. And so if you notice that a person is in more distress than you feel equipped to manage, that is 100% fine. And we always want you to feel comfortable to, to ask for more help and to also normalize needing additional mental health support. That's a totally fine thing for a person to need. So you might offer a hotline number. You might ask if they have a connection to a mental health support, outside of work. And if they don't, you can offer them some suggestions.
That was a great summary. Really appreciate it. I had a lot of questions and uncertainties about PFA before we chatted, but everything's much clearer now. Really appreciate your time. For everyone else watching, please feel free to email smi@maimonidesmed.org for more information about the Stress Metabolism Initiative, or contact either myself or Erica at any time. We'd love to hear from you.